Hello and welcome to the Doctor's Corner. I'm your host as always, Dr. Mark Pinsky, and today I have with me one of my dear special patients, Kristin Smith, who unfortunately was afflicted with a disease called transverse myelitis. Now, that is not the reason why she's on the show, although she may think that, but that is not the reason why she's on the show. She's on the show because I find her story to be truly inspirational, and I know you will as well. You see, Kristin comes to us not just with a disease process, but also as a person who's overcome what I consider to be a lifelong changing disease. And I brought her on because I think she'll serve as an inspiration to many of you out there who are also suffering from other illnesses as well. So I bring to you today, Kristin Smith.
Thank
How are
you.
you?
Good.
Okay. So let's talk about where you're from. Let's talk about the disease process itself a little bit.
Sure.
Talk to me. Where are you from?
Okay, so I'm originally from upstate New York.
Yes.
Yep. Grew up in New England. Went to undergrad school up in New Hampshire.
I didn't know that.
Yeah.
Yeah. All right. Where did you go to school in New Hampshire?
Plymouth State.
Okay.
Very small school.
Yeah, it's a real small school. I didn't know that. Okay. And then you went to college where?
That's where I went to college.
That's went to college.
Yep.
Okay.
Yep.
And where'd you go? You went to graduate school?
Yeah, I started work first
Okay.
down in Huntsville, Alabama. I worked at Marshall Space Flight Center for a few years. Yep.
Okay.
Yep. And then I went to grad school, University of Maryland.
Okay.
Yeah.
And then that's where you did your master's program, right?
Master's, PhD.
Okay, combined.
Yep.
All right. And I was privileged enough to go through some of this process with
Yes.
Kristin. So you got your PhD last year or 2 years ago?
Almost 3 years ago.
Really?
Yes.
3 years ago. I know to you it seems. For me, I'm like, wow, that flew by. But I know that road was incredible. Why? Because when did you get diagnosed with transverse myelitis, or TM as we call it?
Yeah, so TM, I was officially diagnosed 2013, March of 2013.
Okay, and where were you roughly in that process of going through schooling?
I was starting to finish up my master's.
Okay, so
Yeah.
a long way away from where she is right now. And so she gets diagnosed with this incredible disease. Let's go through that process. How did you present with your symptoms? Let's talk about that first.
Sure.
And then what led to the diagnosis?
So I had like a little bit of a cold. It was about a month before I ended up in the hospital. It wasn't anything crazy, just normal sniffles. I wouldn't
Great,
have...
now everybody's going to be freaking out with the coronavirus.
I know. So it wasn't crazy. It was just, typical run-of-the-mill.
Okay.
Then a few days before I ended up in the hospital, my Achilles and my heels, both of them, in my right and left foot started hurting. And then the next day I woke up and I felt super sluggish. The lower part of my back felt like it was on fire, and nothing could really make it feel better. So then by that evening, so about 24 hours probably after my heels started hurting, I had gone to bed, woke up in the middle of the night, still didn't feel good. And the next morning...
Okay, I'm piecing this all together. 2013, right?
2013.
Okay.
Well, December 2012 is when it happened.
Okay.
Yeah.
And so then you go to the hospital.
Yeah.
And what do they do?
So when I went to the hospital, I couldn't walk.
So it had progressed that far from overnight, basically.
Yeah. So when I woke up the morning that I ended up going to the hospital, I felt sluggish all day. That evening, I went and sat down on the couch at my parents' house. I was visiting for the holidays, and I didn't feel good. And 45 minutes later, I said to my parents, you know what? I feel like I can't feel my legs. I feel like I can't tell the difference between something sharp or something dull poking my leg. I couldn't stand. So my parents took me to the emergency room. Right. So within 45 minutes I couldn't stand.
Wow. And then you go to the emergency room. I'm guessing they did a spinal tap?
Not right away.
Okay.
So the first thing they did was send me for an MRI.
Okay.
They wanted to figure out, is this inflammation? Is it a compression? Like, what's going on? Right. I don't really remember too much during that time. My parents and my husband fill in the gaps now.
Okay. That's probably a good thing.
Yeah. So they talked about it maybe being multiple sclerosis,
right.
maybe Guillain-Barré. They might have brought up transverse myelitis. They were considering a pinched nerve or
right.
something compressed in my spine.
All right, so let's talk about TM a little bit.
Yeah.
Right? Incredibly rare.
Yeah.
What's the incidence in just in the United States? So how many people roughly have TM?
1,400 people a year are diagnosed.
A year?
Yeah.
So roughly total, do you know total now how many people have it roughly?
I want to say it's about 40,000, but I could be
Really?
wrong. Yeah.
All right, so 40,000 nationwide. Treatment options?
So basically, what happens with TM is that your immune system becomes overly activated. Right. Either an illness or an infection, something triggers your system to attack itself. In this case with TM, it attacks your spinal cord, causes inflammation. It will demyelinate the myelin covering, the protective covering along the nerves in your spinal cord. And what that does, once you start demyelating the nerves, it stops or slows the communication between your brain and wherever that inflammation has occurred.
Now, do most TM patients, is it involved the lower extremities, or can it be anywhere? Could it be the upper extremities? Can it be total paralysis, like as if you were a total quadriplegic?
Yeah. So there are different ranges. I mean, those that it affects, generally they say it's in these two bimodal areas age-wise, like 10 to 19 or 30 to 39. About 25% is children that it happens to.
Really?
Yeah.
Okay. So you then go from where you were, right? How did you wind up at Hopkins? Because I know you wound up at Johns Hopkins.
Yeah. So I initially was in a hospital in New York for about 45 days. That's where, at the time, they had, based on looking at the MRIs and the spinal tap, they did all the blood work. They felt like I had MS. So it wasn't until I got out of the hospital and was able to see an MS specialist. He heard my story and he said, no, I think you actually have transverse myelitis, which he said this is actually a better thing.
Really?
In my case, yeah.
Really? And do you know why he said that?
I think it's just the difference between the two diseases.
Interesting. Okay, so let's just bring it home a little bit. Both autoimmune disorders, both very difficult to diagnose, incredibly difficult to diagnose. Usually the diagnosis is made over time. So multiple sclerosis usually is a diagnosis MRI brain, and you diagnose lesions over time, right? So what are some of the key factors they look for? You may not even know this, but what are some of the key factors they look for TM? Do they look at an MRI of your brain? Do they look other places for that? Yeah,
so they'll do the MRI, they'll look at the brain, and then your spine, the cervical and the thoracic part of your spine. They look for elevated white blood cell counts.
In the actual spinal cord?
In the spinal fluid,
okay.
Yeah.
Okay.
Yep. And then they actually look at vitamin D levels too.
Right. So we talked about this because I find this fascinating. You know, I'm fascinated by vitamin D. I promote vitamin D all the time. But you're the first patient that I've ever had with TM. And so one of the things you taught me was that they like to have vitamin D levels very high. And if you look at the toxicity level, they talk about the toxicity level being around 100. But he likes it. Your neurologist at Hopkins wants it right around 100. And they find that vitamin D serves as an anti-inflammatory, which I have actually said for years. So now they're just making me look halfway decent. Again, we know that it plays roles in a lot of different diseases. We know that it plays a role in heart failure. The exact mechanism is unknown. I'm guessing in TM, the exact mechanism is unknown, correct?
For the cause of it?
Yeah. No. For why vitamin D helps TM.
That I'm not 100% sure.
I don't think anybody knows what I'm trying to tell you. They just kind of found this out over time. And again, it's a very potent anti-inflammatory. Nobody really knows why. Okay. So let's take it from there. So here's your story. You go to Johns Hopkins. He makes the diagnosis. Yep. What happens from there?
Yeah, so I went to Hopkins because the doctor in New York, he wanted to get a second opinion from colleagues. He was going to reach out to Hopkins anyways, since I was going to school in Maryland, near Baltimore. Yeah. I asked, hey, can I go there in person so he can hear my story? So I went to Hopkins because it's one of the big TM centers.
Interesting. Okay.
Yeah.
I'm always fascinated by these guys who make their livelihood doing these things that are incredibly rare, and then you talk to them, and their world of knowledge is it's amazing, right? It's just amazing. Thank God we have people like that. Yeah. So he sees you, he talks to you. Tell me what happens from there.
So from there, he recommended that I have MRIs twice a year. They wanted to track to see if there was any more inflammation occurring. Because as soon as, they call it an attack, once inflammation shows itself. Right. So in that case, if they see it, they want to stop it as quickly as possible and put you on some form of medication that works for you.
All right, so let me ask you that now. Is there specific medications for TM, or is it global? Like they put you on prednisone, or they put you on other anti-inflammatory agents?
There are specific medications. I luckily haven't had to be on one.
Oh, thank God.
Yeah.
Okay, good.
Yeah.
I knew that already. Good. I'm just saying. So that's awesome. But there are medications. That part I did not know. And these have all passed the FDA, or they're all experimental things?
I believe they're all past the FDA, but these are things just to help, I believe, suppress. Yeah.
Okay.
Not to reverse anything.
Okay.
Yeah.
Okay. So we're not there yet.
No.
All right. And so let's go for your story. So it starts and it ascends, meaning it moves upwards, and it stops at your pelvis, right?
No. So my lack of sensation once the paralysis set in, when I had gone into the hospital that night up in New York, my sensation stops about the bottom of the shoulder blades.
Okay.
Yeah.
Doesn't affect your lung function, doesn't affect your breathing, doesn't affect your heart, doesn't affect any of that. I know that. So
it could be different for different people.
Right, exactly.
But in my case, yeah.
Okay, but it could do all that. And that's what makes, I think, it's the unknown which makes the disease so scary, in my opinion, you know. So you get this diagnosis, you're in the middle of school, you're like, oh my goodness, I had my life planned out for me. Your current husband and you were dating at the time, right? And take it from there. What happens after that?
So in addition to all that, I was also doing an internship down here at NASA.
I forgot about that.
Yeah. So working full time, finishing my graduate degrees.
Now, your master's was not done yet.
Right.
All right. So you're here, you finish your master's, still dealing with the present illness, right? And I got to tell you, the whole time I've known you, just always like this, you know, various smiles, always smiles, happy, you know. I know it's had its times of trials and tribulations, but your outlook of life and what you have done with your life, it really is the reason why I'm talking to you today, because I want people to understand that even in the face of an illness that really seems terrible, there's always something positive that can arise, right? And of course, you are truly blessed. You have a wonderful husband who's a great support network for you. You have a great family around you. But without your own feeling of hope and your own feelings of I can do this, and without your own feelings of I am going to do this, I don't think that any of that happens. So yes, you're blessed beyond belief, but I think that you need to take a little bit of self-worth and understand that what you've done is pretty miraculous. I watched this journey, and I'm fascinated by it. It makes everybody else's journey seem sort of surreal, because what's happened to you is you don't see very many people who can overcome, right? People usually acquiesce to the situation, get suppressed by the situation, and then don't do very well. So here you are in the middle of all this, and complete your PhD, which I know is unbelievable. I got to hear some of that story too. And now you work full time, right? And I know you can't tell me too much, but you work out at NASA, right? You got your PhD in meteorology, right? And what's the best news? First of all, you're doing well. That's the best news, right? There's no progression in your disease. But what's the next thing that happened to you? What did you learn how to just do?
I started driving again.
I love it. Right, so she learned how to drive. So she took her own illness, didn't let it suppress her, took her own, her own way of doing things, and really took forth, and now you're independent and free.
Yes.
I think that's awesome. I really think that's awesome. All right, so what's down the road? What's going on with TM? What's going on with some research, if you know any of that? What do we have to look forward to? Talk to me about that.
Yeah, so we're always trying to raise awareness, reach out to the larger population, because like we talked about, it's such a rare disease. Not many people know about it. And I know they're in the middle of doing some clinical trials involving some stem cells. I think they're more simulated, not real stem cells, but working with actual TM patients. So really it's just staying positive and just waiting for the science to catch up. Keeping your body active, making sure that you're doing everything you can, so once there is some kind of cure or recovery from the paralysis, from the damage that's caused to your spinal cord, that your body will be ready to go.
And that's also a part of Kristin's journey. One of the things that she has done sometimes, and are you still doing it? You still going to Orlando to do that? All right. So she does her own therapy. She gets over to Orlando. That's why it was such a big thing for her to drive, so she could get over there, didn't have to worry about other people and arranging schedules. And she does her own therapy over there, and she continues to work on her upper body strength, which helps allow her to remain independent. And I think that's phenomenal. I just really
I've been grateful for the physical therapists and also personal trainers, because I found somebody locally too near where I live. Yeah.
Oh, awesome.
So Orlando provides me with the type of therapy that I need for those with spinal cord injuries, the type of electrical stimulation that your body, your muscles need, and they have different types of equipment that those with spinal cord injuries can use.
Respond to.
Yeah.
Okay, cool. Yeah. And so now, what's the future look like? What do you think about what's going to happen to Kristin Smith 5 years from now, 10 years from now? What do you want to happen besides there would be a cure? I get that. But what do you want to see happen? Do you want to see, obviously, more research? But from a personal standpoint, what do you want to see?
For myself, I just want to keep progressing with my strength, working out with those that are willing and able to help me, and get stronger, see what I can do for pushing my own limits. I started doing some indoor adaptive rowing.
Love it.
Every year, do competitions. So things like that. Getting out in the community more.
Right. And I vow to you, I told you this, I would love to help you do that. I'd love to make this community aware of people who are, we have such wonderful people in this community. I've shared this with you. Tomorrow I do Brianna Marie's walk for the Brianna Marie Foundation, which is a wonderful organization for childhood illness and more or less diseases in utero. And so we'd like to make people more, that was a very rare disease, fetal hydrops. And we'd like to make people more aware of what's going on with you and how much you've done and how amazing your journey has been. And I told you the truth. I really think that you will serve as a tremendous inspiration to a lot of people who are suffering from a lot of different ailments, whether it be just something simple or whether something as complex as yourself. So anything else? Anything else you want to talk to me about? Well, you talk about anything. Yeah. Jeremy's got all day.
Yeah, I would just say, we talked about how it was, I can be all smiles now. I did have some, not so happy moments there.
Of course.
But I had a great support system, still do. And, I guess the only thing that I would say for those who are going through, not even just spinal cord injury, any kind of disease that's impacting you, look for that silver lining. Right. Find those around you that will help pick you up, encourage you, find people like support groups, even if it's not your friends and your family. I know there are some TM support groups in the area in Central Florida. We've been lucky enough to have those come into our lives who are dear friends now, and their families are affected by TM too. So they're out there.
Right.
You just don't be afraid.
And now you know I brought her on the show. The show. I mean, our conversations in my office are tremendous, and she really is a tremendous inspiration, just a tremendous human being. And I can't say enough about you, and I can't say enough about your husband, who I know has been just a wonderful, wonderful support network for you. So I thank you for the honor and the privilege of not only today, but me allowing me to take care of you. It really is an honor, Kristin. I mean that sincerely. So thank you so much. And on the bottom, do you have a website on the bottom? We can put it on the screen.
Yep. It's called the Siegel Rare Neuroimmune Association, and it's wearesrna.org.
Okay, great. So please go to that website, and actually you can contact us if you have questions for Kristin at drmarkscorner@gmail.com. You can look for us on the web at pinskywellness.com. That's where all of these sessions take place. If you want to tap into YouTube, we're on there too. It's the Doctor's Corner, or you can tap in my name, Dr. Mark Pinsky. For Kristin Smith, I am Dr. Mark Pinsky. For Jeremy Gonzalez, my executive producer, you have been watching The Doctor's Corner. This is Dr. Mark Pinsky once again, asking you to forward questions to us, whether regarding this episode or any of our past episodes, at drmarkscorner@gmail.com. Also, don't forget to check us out on our website, pinskywellness.com or pinskyweightloss.com. We look forward to hearing all of your questions, and we'll get back to you as soon as we do. Y'all have a great week.